Tom McCarthy, and our Education Commissioner, Infante Green. So I'd like to begin to start talking about the masks in the schools. We've been very clear as a group, and I'm included in that group, that from day one, that when it comes to schools, our top priority is our children to be safe and in the classroom. We know that we have one of the best vaccine rollouts in the nation, and vaccines are our way out of the pandemic. We also know right now children under the age of 12 cannot get vaccinated. That's why masking is critical in schools. It buys us a time until more children become eligible for vaccination, so we can continue to build on our best in the nation progress on getting shots in the arms. Until we can vaccinate more students, we need all students in masks. They remain an effective tool to stop the spread of the virus. To help achieve that goal, we've been actively engaged with mayors and school officials across the state as partners. This week, Dr. Alexander Scott sent a letter to the school leaders to underscore just how important this issue is, and to reiterate that what we've been all saying from the very beginning: all schools should be required a mask this fall. I want to thank the doctor and the commissioner for helping us out, get this information out to our districts. The overwhelming majority of our school systems have taken a strong recommendation to require masks, and many more of our remaining systems are prepared to take a vote to require masks over the next few weeks. We've shown as a state that we can come together to make decisions to ensure the health and safety of our kids, our top priority, together and locally. When it comes to the key issues on public health, Rhode Island must ensure students in all districts are protected, and we said, as we said we would do from the start, when we issued a joint statement, the three of us, that we wanted to see all school districts in the state of Rhode Island follow the CDC guidance, which was to have masks on our kids in the schools. So as governor, I will not put student safety at risk. That's why today I'm issuing an executive order requiring masks to be worn in all public schools this fall. I want to be crystal clear. All students will be wearing masks when school starts in September. That's been our goal since we began this discussion. I also want to be very clear with Rhode Islanders about how we are moving forward with this order, and this is very important. The General Assembly recently limited some, but not all, of my power to respond to emergencies like COVID-19 pandemic and its emerging, more contagious variants. That is particularly troublesome since the General Assembly may not return before January of 2022. Today, I'm urging the General Assembly to reconvene immediately, to act as a partner with me in the fight against COVID, and to extend and confirm the useful legal tools that any governor needs to effectively counter this epidemic. With some of my powers under the Emergency Management Act may have been limited, I still have constitutional and public health powers, which I will use to prevent the spread of the Delta and other emerging variants in the schools. To this end, I will sign a new declaration of emergency targeting the Delta variant. At the same time, I will also be invoking my constitutional and public health powers to prevent the spread of infectious disease by requiring masking in all schools that have not already adopted a mandatory mask policy. Next, I'd like to spend a minute focusing on what continues to be one of the most important efforts underway in Rhode Island right now, getting shots in the arms. We know that our best tool to combat COVID-19 and the Delta variant is the vaccine. Getting vaccinated is still the number one thing we can do to keep ourselves and those around us healthy and out of the hospital. And it is the number one thing we can do to prevent COVID-related deaths. That's why, if you haven't already seen, it is time to get vaccinated. It is time. Please get vaccinated. As I promised every week, we're going to be counting down the numbers of eligible Rhode Islanders who haven't been vaccinated. As of this afternoon, there are 182,500 eligible Rhode Islanders who have not yet been vaccinated. My message to them and to their families, it is time. Rhode Island reached out another encouraging milestone this week. 70% of all eligible Rhode Islanders have at least one shot. I want to thank everybody in the state of Rhode Island for responding to our efforts, both in the Department of Health, our National Guard, the municipal leaders, all our first responders, and all our healthcare workers for responding in a way that has got us to that threshold, which again is leading the country in terms of second doses into the arms of the people that live in our state. 63% of all eligible Rhode Islanders are now fully vaccinated. 81.8%, nearly 82% of Rhode Islanders age 18 plus have received at least one shot. And 74% of Rhode Islanders age 18 plus are fully vaccinated. Our goal still is 90% of 18 and olders to be fully vaccinated. And we can accomplish this, and the path ahead of us is very clear. We can hit 90% of our adult population to be fully vaccinated in the state of Rhode Island. Between now and the start of school, Rhode Island needs a full court press on vaccinations. Over the next few weeks, dozens of local clinics will be held at schools and community centers to make it as easy as possible for students and their families to get vaccinated. And I want to thank Tom McCarthy and his team for helping coordinate that with Rhode and people around the state, the local school districts and local leadership to make that happen. We should be setting a goal of at least 90% of our students who are eligible to be vaccinated. Our teachers have done that. We're at 90% of our teachers and related staff as a result of having gone out in late spring with vaccinating all our teachers and our related staff, just as we have done in the child care. Again, 90% of our child care and related staff are vaccinated. Our students, we can achieve that goal of at least 90%. The Commissioner tells me we can hit 100%. So we'll try our best. Over the next few weeks, dozens of those local clinics, I'm going to repeat, will be held at schools and community centers to make it as easy as possible for students and their families to get vaccinated. You'd expect to see all of us, including myself, as I go around to all the clinics in the state to make sure that I say thank you to each and every individual who's volunteering their time and working these clinics to keep Rhode Islanders safe. Next, we'll do a rundown of the COVID numbers as we know them today. Yesterday, we had 314 new cases. A percent positive was 3.4%. We had 4 new deaths. 1 was on August 7th and 3 on August 18th. And 95 people hospitalized. According to the CDC maps, over the last 7 days, Rhode Island leads the nation in the least number of deaths from coronavirus per capita. We had the 7th lowest number of hospitalization patients with coronavirus per capita. And we had the 4th lowest percentage of positive coronavirus tests. We administered the third most COVID-19 tests per capita. And Rhode Island is the 8th in percentage of adults who have received at least one vaccine, and we are 5th in the country on percentage of adults who have been fully vaccinated. This is a tribute to all our workers. And again, I want to thank each and every one of them. I don't have to go in detail again, but Department of Health, our National Guard, our local leaders, our first responders, all our healthcare workers, and hundreds of volunteers who have stepped up over the last several months to make this happen. A quick note on COVID-19 treatment. We want all Rhode Islanders to know that there is a treatment available for those who become sick with COVID-19. Vaccines are designed to prevent serious illness and hospitalizations, but you still can get sick with COVID, and there is treatment available. Now, MABS treatment is FDA approved for those 12 and older. As soon as you test positive and have symptoms, ask your doctor or your local healthcare provider about MABS treatment options. You can get more information at the Department of Health's website. This is yet another great tool in the fight against COVID-19 that will keep Rhode Islanders out of the hospital. Before I wrap up, I want to share that we will be hosting a back-to-school town hall on Facebook Live on Monday, August 23rd at 5:30 p.m. You can tune in on the Rhode Island Department of Education Facebook page, and I'll be joined by Dr. Alexander Scott, along with Commissioner Infante Green, to talk more about a safe return to school this fall. Questions can be submitted in advance. Later today, there will be a submission link posted on RIDE's Facebook page. And with that, I'll turn it over to Dr. Alexander Scott. Thank you, Doctor.
Thank you. Good afternoon. Thank you, everyone, for being with us today. It's so important. Obviously, the focus for many people right now is the return to school, and it's a major focus for us too, as you can imagine. To that end, I want to recognize and thank the governor as well as all the districts that got masking requirements in place for both vaccinated and unvaccinated people over the last few days and weeks. Knowing that we will have masking across the board in schools as soon as possible now allows us to focus all the rest of our attention on the remaining elements of our approach to layered mitigation, which includes the tools we've continually spoken of. Testing, vaccination, treatment where it applies, ventilation, use of stable pods in schools, spacing, screening, all of those mitigation steps that we know make a difference. The CDC has said it, multiple local and national medical organizations have reiterated, and we have known it since the beginning. The public health guidance on masks and schools is crystal clear. Both vaccinated and unvaccinated people in schools must be wearing masks. That's critical, that hasn't changed, and that's what we're going to do for going forward. Why is this such a focus for us? We've known this all along as well. Masks work. They help in limiting or preventing the transmission of COVID-19. And when we have the Delta variant strain that we have now, where one person can infect 6, 7, or 8 people compared to one person infecting 1 or 2 people, as we knew before, masks are even more critical, along with all of the other mitigation components that we know work. Very sadly, we are seeing across the country that schools with loose masking policies or no masking policies are seeing outbreaks of COVID-19. We want to learn from that. We can. We know that this works. Unfortunately, in Texas, at least 4 school districts have already closed temporarily due to COVID-19 outbreaks. Mask wearing was just optional in those 4 school districts. More than 5,500 students at a school district in Central Florida are quarantining currently due to an outbreak of COVID-19. In response, the school board there now is considering implementing a mandatory mask policy. There was not one in place previously. So the opportunity that we have to start now and to focus between now and when school starts to ensure that we have strict compliance with our masking and every other mitigation policy that's in our K-12 guidance will absolutely make a difference. Thankfully, because vaccinating is such a critical piece, we are able to say that we have strong vaccination rates here in Rhode Island, certainly, sadly, better than Texas and Florida and many other places. We all know, without a doubt, the core of our vaccination program that has been run through the Rhode Island Department of Health. We've led in immunizations in the past. We're continuing to do that with COVID. Continues to be at Rhode. Tom and our team, the response for COVID-19 continues to be strong. But it's not just us at Rhode. As the governor has said, It's our partners with the National Guard. It's our municipal leadership. It's our school community. And it's you all, the parents and members of the public, that help make the difference in keeping us ahead in terms of our vaccination rate. While we know we have that strength, there are still many people in Rhode Island who are unvaccinated, either because they are too young to be vaccinated and not yet eligible, or because they just have not yet opted to get vaccinated. The outcomes of that is evident in our case data. When you look at our percent positivity for the month of August, you'll see that our age cohorts with the highest percent positivity rates are almost a mirror image of the age cohorts where our vaccination rates are the lowest. Our 3 age cohorts with the highest percent positivity rates for August are children 5 to 9 years of age, children 10 to 14 years of age, and children 15 to 18 years of age, school-aged children. And while we know those younger than 12 are just simply not eligible, being able to put in place every mitigation step we can is critical. The data from August make the importance of masking in schools clear, and our expectations for September make it clear as well. If we did not have firm mitigation measures in place that we strictly comply with and ensure that they are carried out, we would see hundreds and even thousands of cases among school-aged children during our peak time in September. That's an estimate we're able to make based on the transmissibility of the Delta variant and many other factors. However, with the strong mitigation measures in place, including requiring masking, as we're talking about, and ensuring strict compliance with those mitigation measures, we know that those numbers that can peak high can actually be flattened and occur at much lower rates than they would have been. That's our absolute goal. And we can limit the disruptions to not only school communities, but then subsequently to the economy, because that impacts the parents who need to be able to go to work. We know how to do this. Last spring, there was very little transmission actually within the school setting. That was because schools and districts had systems and requirements like this in place. We've provided that in the guidance that everyone has access to, and we're working with schools to ensure that those systems and requirements are complied with going forward. With schools requiring masks for everyone, schools will be safer environments, and there would be fewer disruptions. For example, our K through 12 guidance this year includes a quarantining exemption for masked students. A K through 12 student exposed to another K through 12 student infected with COVID-19 will not need to quarantine if the exposure occurred in an indoor K through 12 classroom, and if both students were wearing masks, if 3 feet of distance was maintained, and if the other mitigation steps are in our K through 12 guidance are followed and in place. So there is an opportunity using the tools that are at our fingertips to help ensure that there are fewer disruptions in our classrooms, and our school community, families, and students are able to focus on the education and the engagement and interaction in person that we know makes all the difference in the world. As we know, masking, vaccinations, testing, treatment, ventilation, all of these are critical layers of our mitigation steps. From that vaccination standpoint, we are very happy to start offering third doses to Rhode Islanders who are moderately to severely immunocompromised, which started immediately last weekend. We learned on Friday, and with huge kudos to our Rhode vaccination team working with us, Tom and myself, they were ready on Saturday to go and offering immunizations to those who are moderately and severely immunocompromised. We have sent communication directly to healthcare providers, and most of them are also joining with us in doing outreach to their patients who are eligible. It's important to know that our moderately and severely immunocompromised group is a relatively small group of individuals, about 3% of Rhode Islanders, but they are more vulnerable. They are equally as important to us, and it's great news that you can be proud of that Rhode Island was ready within 24 hours to make sure they had access to the vaccine that was needed. And a kudos again to the Rhode team for pushing that out. The last topic I want to hit is on treatment, which the governor touched on as well, particularly with knowing how transmissible Delta variant is. We will continue to see some of the cases, but it's important to know that treatment is available, and it's even more available now. It's fast, easy, and highly effective. It helps keep you from getting sicker, and it helps keep you out of the hospital. We want to access every tool we have to be able to do that. And it's now available for people 12 and older. That's a huge advantage. Please talk to your healthcare provider about whether you should get treatment and where you can get it when you qualify. If you don't have a doctor, don't worry, there are still options available for you. Just visit covid.ri.gov/treatment. And with that, I'll pass it to Tom McCarthy, who is with us at Rhode and helping to lead this.
Thanks, Director. So just wanted to get started, to acknowledge and thank the team that's been working so hard over the summer to make sure that we're prepared for anything we might see in the fall. And as the Director shared, that was on full display over the weekend when, within hours of getting the guidance from the federal government, we were getting shots in the arms in Rhode Island. So on that front, we've administered roughly 1,800 doses to moderately to severely immunocompromised Rhode Islanders, and working with our provider partners to ensure we're getting a dose into every arm. Also, we're now doing the detailed planning on how to operationalize the additional dose availability that was discussed this last week from the federal government, and that's 8 months after your second dose. So we're still awaiting further detailed guidance from the federal government on how that's going to be rolled out, which will direct our thinking on issues like timing and how we're going to best utilize our vaccination infrastructure in order to get those additional doses out. And we'll have more information on this in the coming weeks. Now, in addition to the work that's happening on the vaccination front, a lot of our planning right now is focused on ensuring that we have the critical capacity that we're going to need in all areas of a response for the Delta peak, which we think is likely to occur in the early fall, sometime in the next several weeks. Now, we've started working with Care New England to get everything lined up, so we're ready to activate our alternative hospital site at Saconaset if that becomes necessary. Now, I want to be clear, we're not at a point where we need to utilize this site yet, but it's an enormously complex operation to get an alternative hospital site up and running. So we want to make sure, like we have throughout the response, we're doing everything we can to be prepared for any eventuality. Given the transmissibility of the Delta variant, another preparedness step that we're taking is building out our testing capacity to about 8,000 tests a day at our state-run sites available to the general population. That's on top of an additional 2,000 appointments a day that will be available specifically for K-12, just as we did last year. And to put that in perspective, we're averaging about 3,700 tests a day right now. So again, that's just at our state sites on top of our pharmacy locations, clinic and provider sites, and others throughout the state. So that's my quick operations update. I'll pass things over to the Commissioner, and then we'll be happy to take any questions.
Thank you, Tom. I'd like to start off by thanking Governor McKee for his leadership. Keeping our children safe requires thoughtful and bold action, and today's mask requirement for schools statewide is just that. We need to follow the advice of our public health experts, the CDC and Rhode, in order to keep our children healthy and learning. We're excited for all of Rhode Island students to return to school and experience full academic and social-emotional benefits of learning in person. And in doing this, we must keep our children safe. We're proud of the way that Rhode Island led the nation in coming back to in-person learning in September 2020. But that was only possible with a lot of proper planning, and that is what we're doing now, creating proper plans to mitigate for the upcoming school year. I'm here to provide a brief update on the progress of our back-to-school efforts across the state and answer questions about the health and safety guidance Rhode is recommending to schools as we return back to the classroom. First and foremost, we're working with our local education agencies across the state on back-to-school plans, which are due no later than next Friday, August 27th. Last week, we received the health and safety component of the plans, and those are currently under review by Rhode and Rhode. We will provide feedback and ensure school leaders have the support necessary to start the year successfully. Once the full plans have been reviewed and approved, they will be posted on the LEA websites as well as in backtoschoolri.com for everyone to see. Again, backtoschoolri.com is where you'll get all the information that you need. Back to School RI is also where you can find vaccination clinics in your school district. Yes, we have vaccination clinics locally in your school districts. Vaccines are our best tool in fighting the spread of COVID-19 and the Delta variant. If you are 12 years and older and have not gotten vaccinated, we need you to get your first dose as soon as possible in order to be ready for school. We want you to be in person. We want all our students to be in person, but we want you to be safe, and we want you to be vaccinated. We've made it very easy by bringing it to you. I want to take a moment to thank the superintendents who have been working with us to promote community vaccination clinics being held this month, and those who have stepped up and agreed to host clinics in their school in the upcoming weeks. Dr. Alexander and I sent a letter to the superintendents earlier this week requesting their assistance to improve vaccination rates in our school communities, and they have answered the call, as always. I want to also acknowledge the dedication of our educators who are working tirelessly to prepare for our return to school. Throughout the summer, I visited summer learning programs across the state to connect with the teachers and the students. I saw their excitement of being together firsthand. I'm glad students will once again have in-person learning experience as they need. We know that it's been a difficult 18 months. The kids want to be in school. Earlier this week, I had the opportunity to sit on a professional development as I was greatly impressed by the teachers I saw working hard to ensure that they were ready to give their students the best education possible when schools reopen. To the teachers who are going to be attending professional development days across the state in the next few weeks, thank you for everything you do. Thank you, thank you, thank you. I want to express my sincere appreciation to every superintendent and school administrator working on reopening plans right now. Our administrators work night and day to keep their students healthy, safe, and engaged throughout COVID-19 crisis, and they have not missed a step. To those school leaders who are working under pressure, I want you to know that Rhode sees you, sees your efforts and your hard work, and what you're doing in your communities, and we appreciate you. The dedication and tenacity you have shown in keeping your school safe, healthy, and learning is incredible. More importantly, I want you to know that your students also see you. They see what you're doing in order to make schools safe and reopen. Despite all the chaos and disruption, they have been able to look at you as leaders and know that they're going to be okay. Thank you again for your hard work. And I'm certain that if we continue to work together as a state, both families and educators, we're going to be able to give our students a great full year of learning with growth and joy. And I want to show you, this is going to be our new logo, our kids. This is important. When all of you see this, you know that this is the unity across the state to make things happen for our kids. I know that we're in a time where we're very polarized, but this is the glue that keeps us together, is our students, our kids. Everything we do is to ensure that our kids have the best education possible. Thank you.
All right, great. Let's open up for some questions. We're going to start over there.
This is to the governor. So Governor, I guess we've been waiting for this moment for quite some time. What finally made you decide to go with the mandate?
Well, first of all, this moment has been happening over the last month in every school district in the state of Rhode Island. The discussion about masks has been going on in a public way that we encouraged, all three of us up here, the leadership up here. So anybody who was watching, each time you saw a school district, adopt a masking mandate, we were getting closer and closer to it. We just needed patience to have it all roll out as it has. And so now as the commissioner said, virtually every district in the state has either passed a mandate or they have indicated that they will pass a mandate. So as schools opening up, it's 3 weeks away from today for most schools in the state in that range. We believe that this is a good time to finalize that work that's been happening over the last several weeks. And again, I thank each and every school district in the state for adopting a mask mandate and opening up those conversations in a public way.
All right, great. Over here with John.
Yes, and Governor, I just want to clarify. I heard the mention of 90% of teachers have been vaccinated. How do you know that? And is that a mandate that these are public school teachers, have to be vaccinated to be in the classroom?
We haven't made any mandate there. That's the data that I received, in the spring when we were vaccinating teachers and related staff. I mean, we can confirm that, but that hasn't changed since when I was told that's the case, as well as our child care.
Okay, and I just want to, coming up at 3 o'clock, healthcare workers, some of them are rallying against the mandate. I want to just clarify, they have to be vaccinated, I believe, by October 1st. And do you have any message to the frontline workers that at this point are refusing to be vaccinated?
Yeah, so we need to get all our healthcare workers vaccinated. That's why collectively we made a decision to do that 10 days ago, or whatever it might be. And I was happy to hear that the President of the United States said the same thing yesterday, that healthcare workers need to be vaccinated. And I won't get into the details. I'll let the doctor handle some of these details, but it's pretty well known at this point in time that booster shots are coming. And the people who are going to get the booster shots are going to be in an age group that is predominantly in our nursing home settings and in our healthcare settings. We cannot afford to have anybody working in those settings that's not vaccinated as we come up on the potential time frame, which is a few months away or whatever it might be, away from needing to make sure that we get booster shots to the people that they serve. So we hope and we expect that all healthcare workers will get vaccinated in the state of Rhode Island. I do believe, as I've said before, the FDA approval is going to make it very, very certain that, anybody who's been holding out for, because they thought that there was a health issue with getting vaccinated, which we continually say there isn't, but that's going to make clear the deck on that one. So we need our healthcare workers to get vaccinated. And as I mentioned on that vaccination issue a few weeks back, and was reported that we're in good conversations, strong conversations, with our union representatives and leaders to impact a vaccination strategy for state workers too. What I would expect that you'll be hearing more about that next week.
Governor, hello. What emergency orders do you want to exercise but currently lack and need the General Assembly to come back and restore? What do you want to do? And what does this new emergency declaration change?
Well, the action by the General Assembly when they passed the budget and the statute did not end the emergency in terms of, the basic emergency order in. What it did end was my ability to give executive orders under that emergency. So what this does, and people couldn't, I've been talking to the Speaker and the Senate President today about this very issue. We expect to be meeting early next week about potentially addressing it. But what this current order, based on the Delta variant, it is a a way to exercise the authority I have in a way that addresses this one specific Delta variant. And under that order that I'll sign later today, we can sign executive orders related to the Delta variant, as we will with the mask mandate.
And the first part of the question, what do you need the General Assembly to come back and restore?
So what we had asked during the budget process, as the discussion was to pick a date of September 1st that basically said that the COVID emergency would be over September 1st, because again, I was not able to execute any executive orders under that that overriding emergency orders. That's still in place, as we've talked about. We're still taking advantage of all the federal dollars that could possibly come in. By the way, that's been extended now to the end of December. So we're smart to be able to do that. So the General Assembly knows, I think they understand that at this point in time, we're going to have to do like end arounds going forward. Now, when the Delta ends, we're going to have to decide whether that executive, that emergency order ends. And as it was, which Tom said, we're looking at early fall. But there may be another variant that's going to come in. We don't know what's around the corner. So what we're asking is, go on the original emergency order that was put in place by Governor Raimondo. Don't have it expired 180 days as the statute said, and extend that as we requested at the time that the budget was being passed, to have it extend into January so that we don't have to do these end arounds to address a pandemic that hasn't ended.
Dr. Scott, I have personally interviewed mothers in tears because they see masking as literal torture for their young children. They remain unconvinced that cloth masking, particularly on a young child, has little more than a placebo effect. What substantiation do you offer to them beyond masks work? Under what circumstances will the order stand down? And finally, it is no secret they have organized statewide. Are you in the state of Rhode Island prepared for noncompliance?
We have countless examples of data stories locally, nationally, and internationally that show definitive improvements in our case rate data when masking is required. Just based on the science of how coronavirus and other respiratory viruses are transmitted, masking is an effective, doable tool that stops, inhibits, and slows transmission of that virus, that organism, from one individual to another. We have not only seen decreases in cases regarding coronavirus, but have also seen decreases in cases regarding other respiratory viruses when masking was required. You can ask many of the teachers nationally or the students themselves. Our students have done great. They have really been the champions in being able to say, we can do this. We can wear a mask. We can be safe. We would much rather do that and be in person, in school, benefiting from all of the positives that come with that, rather than not wear a mask and have to risk staying home or deal with the many disruptions that occur from the countless outbreaks that we are seeing nationwide, including what I shared earlier today, when people are not masked. So we hope that the science, the data that we're saying consistently, that is being demonstrated time and time again, is enough for the parents who are out there to know we are with them and wanting to make sure that their children are safe and can get the best education they need. This is the way to do it, and it's going to be necessary across the board. So we hope they can join with us.
The rest of the question, though, under what circumstances, what metrics, what objectives will the order stand down? And again, it's clear that they've organized statewide. How will the state respond to noncompliance for public education?
We will continue to follow the data and look for the flattening of the curve that we're expecting to see in terms of making decisions about how to proceed. from there and make those recommendations to the governor, as we have been and will continue to do, is our responsibility going forward. And in terms of how to handle, we hope that that won't be the case, because people will understand what the data and science is saying, why this is necessary, and how it can be beneficial for all of our students. And we'll take it as we go from there.
Final
question
follow-up.
over here.
You'll provide us that data, as that you talked about earlier in our conversation, that substantiates your position?
We continually do. We definitely welcome everyone to go to our website, help.ri.gov. We have a tremendous data hub there. It's where we want that to be a resource for all Rhode Islanders. We have an A-plus data team at Rhode and with all of our partners, so please take advantage of that.
Okay, we're going to move on over here.
Dr. Alexander Scott, we keep hearing about the booster shots being available next month. If you are a nursing home resident, what will that process look like, and are you hearing any specific dates for next month?
Yep, we're continuing to work with our federal partners to better understand what the optimal rollout is. And similar to how we have approached everything thus far, we're making sure that Rhode Island is ready. We have the capacity in place, we have the partners who are lined up, and we're going to be eager to get going as soon as possible. And we'll certainly be looking to see how early we can make that date and make the vaccine available. So time will tell as we continue to engage with our federal partners, but Rhode Islanders have experienced and will continue to know that we're ready.
All right, thank you. Steve?
Governor, good afternoon. Governor Baker in Massachusetts today issued an order that's been described as one of the strongest of its kind in the nation, ordering all executive department employees to be vaccinated by a date certain, October 17th, or face disciplinary action, including an up to termination. Would you consider such a thing? Is this part of your negotiations with state employees here?
Yeah, we'll have details on that. We announced that. It was reported, a few weeks ago that we're in conversations about vaccinations for our state employees. I can't tell you the details right now, but I did talk to Jim Thorson earlier today about this specifically, and he was very optimistic that we will have some form of vaccinations policy in place. It's not easy, it's complicated, and we want to make sure that we do it right, and I would expect that something will become available in terms of information next week.
What do you think of Governor Baker's order?
Well, I think that, first of all, I was on the phone with Governor Baker talking about some of these things earlier in the week and comparing notes. So I know that he's a good governor. So you always can learn from good executives. So we'll take a look at what he said and see whether that applies here in Rhode Island.
Commissioner, this is the third year in a row that schools are going to be disrupted by COVID-19. If a student has to quarantine, there might be learning loss again, and packets for 7 to 10 days aren't really cutting it for some teachers and parents. Can you kind of just give us an update on what the state or the LEAP task force is doing to address the learning loss for this year?
Sure, but it hasn't been 3 years, just to be clear. COVID-19 started in 2020. So what we are doing and what the districts are doing is ensuring that the students have the extra support that they need for the time that they've already been in a very difficult situation. So moving forward, there will be programs that will continue during the weekends, after school. So there's a lot of things that is directly related for the students. That's what we're doing right now, and that's what the districts are doing. All of the district plans that will be submitted on August 27th will include the instructional portion. So those we will be able to make public so that everybody knows specifically what their districts and schools are offering.
Okay. And then, Governor, according to the CDC, every single county in Rhode Island currently has high transmission as of this week. Why aren't we implementing a statewide indoor mask mandate for all businesses? And are you still standing strong that it could affect the economy, could affect small businesses?
Well, I think that we're addressing the masking, over the last several weeks with all the local districts. I'm very happy, again, that they stepped up, and I think virtually every district in the state of Rhode Island has come to that conclusion without a mandate we're putting the mandate in just as a precaution today. As far as the economy goes, we are doing fine. Our hospitalization rates are nationally are not, are certainly leading. I've mentioned that, reporting on the key issues in terms of death rates. In terms of infection rates, we were like, I think, the third strongest infection rate per capita last week. We'll see where we are before we make those determinations. But we are holding on, which is critical. I mean, in terms of like the economy, third in the country right now, number one in the Northeast in our recovery, and yet we still have been able to keep people safe and relatively out of the hospital and continue with the vaccinations. We'll deal with that at the moment in time where it might be need to be dealt with. Right now, I don't see that as something that we should be doing today. You could be doing it next week, but at this point in time, let's get people vaccinated. Let's keep people safe. And today, we're making a move on to make sure we open our schools safely.
So just to be clear, that you're looking at hospitalizations and fatalities related to COVID in order to implement some type of indoor mask mandate, and what would that threshold be?
Yeah, so I don't think that's determined. Look, we got a pretty good team up here that's had a lot of success, and we all have our strengths, and we certainly go to our strengths. So this is a collective effort at this point in time. We're taking care of the finishing ideas on the schools. We're making you aware that the whole process has been complicated by the General Assembly, calling that September 1st was the end of the COVID pandemic, and it has complicated things to a certain degree. We're in a position to make those moves right now as long as the Delta's there, but that's why we would like to, we're asking the General Assembly to consider to come back and reinstitute the full authorities and not have me have to use certain authorities that I have that, are a little awkward. So, and I think it's been awkward even in the explanation over the last several weeks in terms of I don't think everybody's really grasps, what we're dealing with in terms of getting through it. Right now, we're going to do the schools. We're going to get those open safely. We're going to evaluate all the issues. We'll make those decisions based on data. Today, we're not in a position where we need to roll back our economy. And individuals know we're making it very, very aware of the Delta that we're having, and people can make their own decisions on what they particularly do. But at this point in time, we're not going to issue any form of restrictions into our business community.
Thank you. We have time for a few more questions.
Tanya Signori from the Rhode Island Wave. If you look at the numbers, there's technically a 98% chance of surviving COVID, which is actually very good news. If you look at all the numbers that are on the website, thousands of Rhode Islanders have had COVID from day one, and about 2,700 or so have died. I personally know 3. It's a very sad and a very, very scary situation. I am not minimizing deaths. I am just saying, overall, numbers are numbers. It's a very low chance. That doesn't mean we can't be safe still. Let's be safe. Let's get vaccinated. Let's wear a mask. Why can't it be people's own personal choice, though, if they want to be vaccinated or wear a mask or both or one or the other? I myself have been vaccinated from earlier in the year, but I don't feel I need everybody around me to be vaccinated to feel safe. I could stay vaccinated. I could wear a mask. Why do I have to expect? So, for example, if someone has a compromised immune system and they walk into a church with a mask on, that's good. But it doesn't mean everyone else around them has to wear a mask. So when are we going to come to a place where it's a little more relaxed and people can just take care of their own health and be their own self and say, okay, I'm not going to go to a crowded event. I am going to wear a mask. I am going to get vaccinated. When can it come to a point where Rhode Islanders make that decision for themselves?
So I'll let the doctor handle the medical side of it. I'll just tell you where we stand on that issue, right? It's our job to collectively come together and make sure that we make decisions in the broader communities, keeping them safe. The things that we're doing here today are not done, without a great deal of thought and a great deal of data. So as long as I'm convinced as governor that we need to put these precautions in place, these type of policies in place, we're going to do it. As I've said, safety is our number one priority. We want our economy to open up, but again, if our economy is at risk because our health is at risk, we're going to side on the health side of things. And then as far as the schools go, they've been one of the 3 top priorities for me. Health's number one priority, making sure that the economy opens, and making sure the schools open safely, and I think that we're headed in that direction. If the doctor wants to weigh on some of the medical reasons why we need to do this thing, I'd be happy to
have
From a public health perspective, particularly when you have the Delta variant as transmissible as it is, it no longer works to say one person can mask and vaccinate and the other person cannot. When you have pockets of unvaccinated populations in place or unmasked populations, that overflows and impacts the areas where people are vaccinated and or masked. And so we need to take a public health population level approach in order to keep everyone safe in the midst of the surge of this Delta variant right now.
Thank you. Last question.
For Commissioner Infante-Green, well, it's two parts. Last academic year, we had choices that individual parents and students could be virtual out of school if they did not feel comfortable being in school. And under the present circumstances, I think that there are going to continue to be parents and students who might opt to continue virtual learning if they are uncomfortable for whatever reason with the risks of being in school. If they have an individual concern, the child has a health issue, is immunocompromised, they don't want their kid wearing a mask, whatever it is there going to be a similar option that schools are expected to offer for students and parents who would prefer to avoid in-person education?
So let me start by clarifying. For those students that are medically fragile, there is an option for them. So that's first and foremost. If we go back to the president's mandate of going back to school in person, that is what we are doing at this present moment, is making sure that our kids get in-person instruction, which we know is the best form of education. Also, socio-emotionally, we know that the kids benefit from it. So right now, that option does not exist. That's why masks are so important. That's why vaccines are important. We have to follow the science and keep moving forward.